3:30 p.m. on Tuesday, April 21st, 2020. Thank you for joining us. This is Janet Hill with the Rock Island County Health Department. Today, we do not have prepared statements, but both Nita Ludwig, the administrator at Rock Island County, and Ed Rivers, the director of Scott County, are here to answer your questions. We ask that you direct the questions to the person you want the answer from in the chat box. And then, as always, the question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. Nita, please start us off with Rock Island County case numbers. Thank you.
Sure. Today, Rock Island County Health Department is reporting 3 new COVID-19 cases for a total of 281 total cases for the county. There are still 5 total deaths for Rock Island County. 21 people are currently hospitalized related to COVID-19. I do want to take just one moment to correct something. It had been reported previously that Friendship Manor in Rock Island had positive cases of COVID-19. I would just like to clarify that there have been no deaths at Friendship Manor. I think that was miscommunicated in some areas. Thank you.
In Scott County, the report from our Department of Public Health today is 180 cases for an increase of 8 since yesterday.
Okay, thank you. We did have a couple of questions that were submitted ahead of time, so we'll start with those, and then please type any that you have in the chat. First question, are the Rock Island and Scott County Health Departments keeping track of the ethnicities of COVID-19 patients? And if so, would you please provide that information? I'm sure you're well aware of the national news stories about the disproportionate impact on minorities in some locations. Go ahead, Ed.
Yeah, we acknowledge the long-standing disparities that exist among racial and income groups in different areas of health. Demographics, including race, are collected for all communicable diseases that are followed up on by local public health, including COVID-19. We collect the data when we're following up on positive cases, and we're hoping to be able to share county-level demographic data in the future.
Nita, do you want to address that for Rock Island County?
Sure. For Rock Island County, racial and ethnic data can be collected on the patient under investigation form that providers fill out and send to us. However, not all providers are filling out this field. So we are trying to add that information when we do our contact tracing, but it didn't start from the beginning of this whole situation. We currently do not have the staff or the capacity to go back through all of those records and collect that at this time. I do see that looking through the data that we do have, it does seem apparent that more Hispanic and African American or Asian folks are affected in our area. Dr. Ezike, the medical director for IDPH, has talked about the state going back and collecting this data after, in the future. There is a pie chart that breaks down somewhat the information on the dph.illinois.gov COVID-19 statistics. That's dph.illinois.gov/COVID-19, and then you can scroll down for more statistics. But there still is a large part of that pie chart that was left unanswered on those questions of race and ethnicity.
Thank you both. Next question, how prepared are our hospitals for a peak in the pandemic? How many ICU beds are being used and how many are free? Is it enough? And when are they estimating things will peak here? What does that timeline look like? Ed, do you want to respond to this question that's for the hospital systems?
Well, our health systems joined the call. We can have a go and provide us updates on their capacity and surge plans. You can reach out to them for any updates, and perhaps we'll have them on again in the near future. But both health systems do report information on capacity to both Iowa and Illinois Departments of Public Health, and that information is posted on their dashboards on their website. For the Iowa Department of Public Health, it reports out capacity by region.
Thank you. Are there any health providers in the QC offering COVID-19 antibody tests, or do they plan to? Do you know for that, Ed, from our side of the river? And then we can go to Nita.
We're not aware of any antibody testing taking place in Scott County. However, the governor did speak to that type of testing taking place in the near future, and we anticipate that the state health departments will provide an update on that soon.
Nita, do you want to respond for Rock Island County?
Sure, we currently have no information from our state about antibody testing at this time either.
Okay, there's one last question that came ahead of time, so we'll go to that and then go to the chat. Are there any plans to try to return to containment when new infections get low enough? And what would that take in terms of testing, contact tracing? Ed, would you like to start with this one?
Sure. From the start of this pandemic, the guidance from both states has changed as we've moved along in response to the spread of the virus. The original effort in Iowa was focused on containment, and during that time there was aggressive follow-up being done to determine the who, what, and when of travel and exposure. Some people were put under public health orders from the State Department, and contact was made with those individuals twice daily. But once community spread was evident, that response changed to mitigation. Contact tracing changed at that point as well. When a positive case is reported to us, Scott County, we interview the case, or a close family member if unable to interview the case because of illness status, determine close household contacts. And household contacts are the priority due to their being at most risk. We ask if any of those individuals are experiencing symptoms, and if so, we interview them as well. Both the case and the close household contacts are told to self-isolate. Therefore, the focus of our work is to slow down further spread. We anticipate that changes could occur as the number of cases change. However, we can't be certain what that would look like.
Nita, do you have anything to add to that question?
I would just add that for once in our lifetimes, contact tracing is exactly the same on the Illinois side of the river. So while we're always talking about how we differ just a little bit, what Ed said about contact tracing is exactly the same process in Illinois.
Thank you. We'll go to the chat. Nita, the first question is for you. Is there any word on testing at Tyson plants, and is there information coming out of Warren County that at least 2 Smithfield employees who tested positive are Rock Island County residents?
Well, I can't speak to any specific cases for privacy reasons, but I would say there is testing going on for anyone that meets the criteria. And there are symptomatic, criteria that people are meeting that they are getting tested in this area.
Next question. Are the county health departments trying new ways to help minorities deal with COVID-19? Nita, do you want to address that first?
Sure. We are trying to get our messages out in some of the different languages that we see in our county. And actually, Janet, as our PIO, she has been working with World Relief in Moline. They have a number of different interpreters who can help us. I think they are planning to make some short videos in different languages that we will be posting on our social media and on our website as well.
Ed, do you want to add anything to that?
Yeah, we're working together with them on that. Plus, when we interview people, it's often required that we use translators in order to get our message across.
If there are 13 new cases in Rock Island County, what is the new number of total cases? Was the new number the same one that you reported at the beginning, Janet and Nita, the 281?
Yes, that is the current total to date.
Okay, thank you. Ed and Nita, based on your own observations, do you feel the public are wearing masks as they should?
I can't give you any feedback on that because I'm following my own advice. I stay at home and come to work. And my wife handles the essential trips, so I haven't been out to see people wearing masks.
Nita, do you want to respond to that as well?
Sure. Well, I do the grocery shopping in my household, so I have been to a few stores in Rock Island County, and it does appear that most everyone is wearing masks when I've been in there. I think a lot of the grocery stores have done a really good job of marking off in different ways how to keep 6 feet distance between yourself and others. A lot of them say 2 grocery carts, or they've got marks on the floors. Some have even made certain aisles one way, so you can go down one way and come up a different aisle the other way. So I think and I've seen them cleaning and disinfecting carts. I think they're doing a great job.
Next question. It seems like future testing is unclear in terms of how it will be accomplished. From your perspectives, are there the beginnings of any plans for expanded testing? With the prospect of people being called back to work, will the health department work with employers to expand testing?
I think the governor covered that under the Test Iowa program today. They have a fairly ambitious program to, as she put it, identify hotspots in the community and move towards the eventual relaxation of the restrictions, and using that program to inform that process.
Would you like to add anything, Nita?
I would just say from the Illinois side, I know our Governor Pritzker has talked about expanding testing. I know he would like to see more tests done a day, and he is trying to acquire the supplies, reagents, all those things needed to be able to do more testing in Illinois.
Okay, looks like we don't have any additional questions, so thank you all for joining us today, and we look forward to talking with you again later this week. Have a good day.